Are we live? I hope so. Oh, hey everyone. Hello, bonjour, Connect Hearing community. How is everybody doing today? Just gonna wait a minute or so here for everybody to join me. And then we're gonna start with this special live uh, giveaway Facebook for today. If Lindsay can just give me a thumbs up here or send me on a private chat that I'm live, that'd be great. Um, all right, perfect. Okay. Hello, bonjour, Connect Hearing community. I thought about starting this Facebook as the most wonderful time of the year. Bling, blow. It's almost Christmas, and it's going to be a really very exciting Facebook Live. And I have, prizes to give away, and I'll be sharing 5 hearing health tips for better year of hearing ahead. Okay, so have some very good information here to share with you. I'm Cristiane Basilio. I am a doctor of audiology, and I have been helping patients with hearing loss for over 20 years now. But before I start, I will just gonna add my comments here so I can see people. Oh, hello, hi, Marlo. I can see now. But before I start, I just want to talk a little bit about our giveaway, so you know what you have to do, and sharing these great prizes that we're gonna give it today. So the very first winner will win a Roger 2 On. That is an external microphone that I will be explaining more about at the end of this not workshop, but this presentation, let's say. And then the second winner will be getting a backpack with a lot of things from Connect Hearing, that you can also choose a gift card, this $100 gift card from Starbucks or Tim Hortons, and a reusable plug from Audio Nova. That will be also one of the prizes included on those. So if you want to enter this this holiday giveaway, all I needed to do is to like this video. So give me some thumbs up, just give me some hearts there, follow or like Connect Hearing page, and ask me a question or add a comment, that you are gonna get a bonus entry. I can already see a lot of people. Wow, from South Carolina, USA. Hello, Beverly. Welcome to our lives. So let's jump into these topics today. That is 5 hearing health tips for better year of hearing ahead. Okay. I was thinking what would be the very first number one tip that I want to share, and I had shared a few times about this, but it's noise protection. I do have more little information today to share with you, but the reason I added that as a first, topic is it's much easier for us to prevent a hearing loss than then having to deal with that issue afterwards, right? And when we are preventing hearing loss, we are also preventing us to develop tinnitus. So tinnitus is a symptom that you perceive sounds. You might be in your head, you might be in right ear or left ear, but can be very bothersome for a lot of people. So when we are preventing a noise-induced hearing loss, we are also preventing developing tinnitus as well. Okay, there's a strong correlation there. So the risk for a noise-induced hearing loss, it really depends on how often we are exposed, which kind of sound, the duration of sound, and this sound can be exposed to personal devices like earbuds, headphones. I think in our life now we use so much of the digital equipments, right? We are always on the phone, we are maybe doing FaceTime, and we just need to be aware of that. Okay. Meetings at work, of course, a big part of it. Other situations that we need to be aware of it are situations where we go to sports, like big stadiums, fitness classes. Even I have a colleague, she said every time she uses her Vitamix, those blenders that makes a lot of noise, she pop in her earplug. So we need to be extra cautious of what we are exposed to, okay? And hearing protections can really help us, and there is a variety of different type of hearing protections out there. Okay, so I want to just show you options that you can choose from, and of course, us as a hearing care professional, we can always guide you better on what you can choose. So there are hearing protections that are custom made, the very top photo on the top. Then we have reusable styles, and we have situations where we have to double up hearing protection as well with headphones on top of it. Okay. But what I want to show today that is super interesting are these custom protections that have different filters that we can choose from. So if you are, for example, someone that likes to ride motorcycles, or if you're a hunter, or if you just use a lot of power tools, there are specific plugs for those scenarios, for those situations. And they have different filters that we can choose. And of course, we are here to help you finding what will be the best option for you. But it's important to be aware of this great technology that we have for hearing protection as well. Okay. For sleeping, for swimming. So just making sure you are talking to your hearing care professional and sharing your lifestyle, sharing your habits. Sometimes you go for hearing test, and you might be thinking you have a hearing loss, and then we do a hearing test, and it's a normal hearing test, but maybe you're already having some temporary changes of your hearing in some of those scenarios that I mentioned to you, and you don't think about talking of those situations, and maybe the hearing care professional you're seeing doesn't ask you those questions as well. So just make sure you're sharing those environments that you are exposed to, so we can give you the better recommendation. Okay. And another important thing that I want to bring it up on being exposed to loud situations is the noise does not hurt only our ears. Okay, so noise can really affect our emotional being, our mental. It can really increase our mental stress. It can even elevate our high blood pressure in some situations. It can change our concentration, attention, and our sleep, right? So how the older we get, we have this light sleep that's affecting me as well already. And if we don't sleep well, that can be really problematic the next day. And you might think that you're hearing loss, but it's really because you couldn't sleep well that you cannot really focus well the next day. So just be aware of that. That's one of my topic, the very top first hearing health tips for this year. Okay. My second tip for good hearing health, and I don't think I ever mentioned that on my other videos before, are about medications. I don't know if you're aware, but we have more than 200 medications that could cause a temporary or a permanent changes in our auditory system. Okay, so super important if you start taking a new medication is to be aware, of course, of the side effects, because some of them could be hearing loss and tinnitus. I would say tinnitus is one of the first one that might show up. That already kind of shows that might have that medication is affecting your auditory system, your hearing system. So we just want to make sure that you notice that, and if that's happening, talk to your doctor. They might not be able to change the medication, but they might be able to change the dose, or they might be able to change the medication. Okay. One medication that people sometimes are not aware of it, if you take like high dose of aspirin, for example, you can develop tinnitus. And if we stop taking that, then we can reverse the effect of tinnitus if we do that quicker than later. Okay. So just pay attention on your body reaction when you start taking new medications. Okay. My third step here, and that I would like to talk about it, and I think a lot of people always like to talk about earwax. I don't know, it's a very popular topic, but earwax, it's something that can really affect our hearing, you can also notice tinnitus because of earwax. So in this photo, I just show you the earwax is produced in the very beginning of our ear canal. And that's where our hearing aid sits. Okay, so if you are a patient where you are having to clean your ear wax filters every day you take your hearing aid out and you see some wax in there, we should probably get this wax removed for you. Okay, so super important before you attempt to do the wax removal yourself is to see your physician, see your hearing care professional, because some type of wax removal tools have contraindications. Okay, so one of them is the, let's say, the simple wax tool that we see out there. There's like a little bulb that you add some warm water, you can wash your ears, and that can be very safe for the majority of people. But if you are someone that keep having recurrent ear infections, or you had a perforated eardrum in the past, we don't want to add too much moisture and adding water in your ears. Okay, so other situation is, for example, there is suction equipments that we can use, like a vacuum that we can get the wax out. But if you have tinnitus, because the suction machine is very noisy, that might not be a great solution in your case, because that could exacerbate that feeling of tinnitus, that perception of tinnitus. Okay, so I added this photo as well, just gonna bring that back, because you see the middle picture has a very soft wax. And if we just add oil to our ears and inside of our ears, and we don't have anybody checking, that means your wax is just gonna become like a big block of a soft wax, but it's not gonna really help you. We still need to get this out. Okay, so the oil can be a great option as a maintenance. And when you have an appointment, you have the wax removed. But if the ear is completely already full of wax, that oil is not going to be doing much, okay, besides making soft. Okay, so just having that recommendation and having someone look in your ears, then would be always the best way to start that treatment. And then we can give you ways to keep it up with the ears cleaned. Okay, but if you do use oil and that seems to work with you, and that was the recommendation, ideally let's go for something that's not as thick like olive oil, so maybe a mineral oil or baby oil, or there are some other products that we can recommend in the clinic that not only soften the wax but also dissolves the wax. And if you have a very tiny ear canal, that might be a better option. Okay, so that was my very third tip. I see a lot of questions here. That's awesome. We'll have time for to answer that at the end of this call today. So my very fourth tip for this year, what I would like to talk, and I want to spend a bit more time on this, it's about hearing and our brain health. Okay, so why is so important for us to do our annual checkup, if you have hearing aids or if you don't have a hearing aid, and then to treat a hearing loss if you have hearing loss? I'm not sure if you know, but our hearing really supports our brain health. Okay, so untreated hearing loss, it is a risk factor for our brain health, and brain health is a key for our overall health. Okay, so from this presentation, I want you to keep in mind that when we are treating our hearing, we're also treating our well-being, and we're helping our brain health as well. Okay, so let me start this way. Why do you think it's so important to have our hearing checkup? Because not only when you don't have a hearing loss that you don't know if you have, or you already have hearing aids and you're struggling with the hearing aids, what happens in our brain is when we have a hearing loss, that leads us to difficulties in understanding, in communicating, correct? And when our brain is not getting the information that it needs from our ears, it really apply a lot of, we're removing cognitive information from other areas of our brain to help us to hear and understand. So this happens that our brain is really focusing, our strength, and there's a lot of mental fatigue by the end of the day. And that compensation that our brain does can start affecting other tasks that our brain is supposed to do. So one of them is, for example, our working memory. We have a different type of memories, and the working memory is that one that normally will be temporarily manipulate our information. So when we learn something, or if someone tells you, oh, can you buy some potato in the supermarket, and then you get in the supermarket an hour later and you forget about that, for example. Okay, so that's our working memory that's happening there. So if we are not providing information from our ears to our brain, that working memory can be affected. One of the good examples that I want to mention to you is a lot of times we have family members coming to the clinic with a worry that maybe their grandparents or their parents are suffering from dementia, or they're suffering from Alzheimer's. And then a lot of situations is that because they're not hearing well, they're not being able to remember things. Okay, so they're not really suffering from Alzheimer. They're just needing to treat their hearing loss. So if you have anybody in the family that you suspect of suffering from those health problems, let's first having their hearing checked. Okay, because that might be just a matter of start wearing hearing aids they can improve their working memory again. Okay, so hearing loss can make our brain to work more, the more challenges in our brain. And then if we start wearing hearing aids, if you have a hearing loss, that can improve our audibility of sound, that can require less effort from our brain, and then we can communicate. And to communicate well, we need to hear well, and then we need to think well. Okay, so just want to show you something to just as a summary here, why, okay, we needed to make sure we are improving our hearing and having our hearing checked. And that goes as well for when you have hearing aids. You might have a hearing aid that's 7, 8 years old, and if they're not providing you the best audibility, all that issues in your brain that I was mentioning is going to happen as well. Okay, it's kind of you're not treating your hearing loss properly. So making sure going back to the clinic. Okay, hearing aids does not last forever. Your hearing changes over time, so you really need that follow up on a regular basis. All right. This is just for us to end this topic. This is a really great way for you to see what's happening in our brain when we have hearing loss. So the ears, what it does, it just is responsible just for picking up all the sounds and sending to our brain. And it's just in parts, as you can see that, like a puzzle. Okay, and that's our brain that will put all that puzzle together. Okay, so treating hearing loss is much more than just hearing your partner across the table. All right, it involves way more mechanisms in our brain, and we want to keep our brain healthy. I mean, so making sure we're checking those out. Okay, making sure we have our annual checkup on a regular basis. And my fifth tip, before I go over your questions, is about improvements in technology, improvements on not only hearing aids, but accessories that we can add. And all of that are also to help our cognitive load here, right? It's always to help your communication. So every time we are implementing a new accessory that might help you to hear at a distance, or might help you to hear better in that workshop, maybe in the theater, then we are taking away some of that strength that you are putting in to hear better, to keep our brain health as well. Okay. And that brings me to our fifth topic, that is about Roger. Okay, and that's what you can win if you're the first lucky winner. Roger is an external microphone. So to make it clear, Roger, for you to be able to use Roger, you need to have hearing aids. Okay, so it's an accessory that works in conjunction with the hearing aid, and is an external microphone that will provide a boost in speech when you are trying to understand and communicating in situations where you have loud sounds or a very high ceiling place, or at a distance if it's like a longer table, for example, or you are in a presentation, maybe a work meeting where it's like a round table. So there are many scenarios that we can discuss with you. You can use Roger playing golf because you're in an open area. You can use Roger if you're in a fitness class. So there's so many areas you can use Roger. And Roger can really boost that speech understanding, that we can have the majority of time in situations that we really want to hear, right? So if you see, this is what the Roger does. It's a very sophisticated kind of microphone that kind of calculates and measure the speech that's coming around 360 degrees, and it adapts that microphone to where the sound is coming from. You might ask me, but Christiane, doesn't the hearing aid is supposed to do that? Because we talk about so much of the features on the hearing aids, and especially the directional microphones and what they do. And yes, it is I would say is a first step. The hearing aid can do that. It will adapt to the situation you're at, but it has a limitation of the distance that picks up the sound. So about 5 feet away is kind of when you hear the best with hearing aids. If there is sounds that are a little further from that, then it can already start affecting your speech understanding. Okay, and that's the situation that comes Roger. So when this type of technology started, we really focus more with patients that had a more severe profound loss, but we learned over the years and with the improvement in technology as well, that's not only for who has a severe hearing loss. It can really help pretty much any type of hearing loss. It's really depending on your lifestyle needs. Okay, so super important to learn about that. And the other thing that Roger can help as well is with this type of scenario when you were watching videos online or when you were having meetings online. The new Roger On has also a microphone, so it will pick up your voice as well. So that was one of the improvements of this Roger On the second generation. Okay, I would say what we had 1, 2, 3, 4, 5. Maybe this is already the fifth generation of Roger. So technology is improving much faster than it used to be. What's kind of really nice to see. And yeah, and just as to finalize this Roger topic here, about 30% of patients, even though they wear hearing aids, they still struggling in noise. Okay, so super important for you to share that with family members, because sometimes they expect that you get hearing aids and that's it. Is I got everything fixed now. And they get frustrated because you're still not able to hear maybe in a noisy restroom, for example. And that's the reason. Okay, it depends on your hearing loss. It depends on the environment. It depends in so many different things there that you might need more than just a hearing aid. You might need an accessory to help you in those environments as well. Okay, Roger can help in landline phone. It can also give you the sound from the TV. So there's many things you can do with Roger, okay, that can help you in those scenarios. So I think that's what I had for the the 5, let's say, hearing health tips for this year. We do have lot of questions here. Let me go over them. I love those questions. I think we always have good discussions in these lives from these questions, and I always get really good feedback that people learn something from these live videos. Oh, hey, David Evans. That's so nice seeing everybody. Okay, Ontario, Canada. That's awesome. Okay, so let me see. I have a question here. Mala Desjarlais. What kind of earbuds should my teenage boy be using? Beautiful question. So earbuds, let's think about the earbuds and the headphones. One of the advantages of having headphones, especially if you're more in a noisy place, is because you are blocking the outside noise. So then you are able to keep the sound lower and still hear them. So if you're a teenager, like just to use, I'm using, for example, the AirPod Pro, that can be a good option because it has a noise blocking, right? It has a noise reduction. So if I am, for example, in a SkyTrain, or I am in any situation like, outside that's noisy, if I have this ear plug, then I can block more the noise around, and then hear better, so I can keep my volume lower. Okay. We have to talk about safety as well. The problem is sometimes this type of noise protection, this noise reduction headphones or earbuds is not safe for you to be walking outside, right? So I think it really depends on the situation. If they're more home, or if they're in a situation where there's noise, but they're not like walking outside, that they need to be worried about safety. Having something that has a good noise reduction, headphones, I would say one of the best because you really block everything around you. But the AirPod Pros can be a good option in those environments as well. Okay. But super important to make them aware of keeping the volume. So when they look at on the phone, keeping the volume halfway. When you see the volume bar, halfway down. Okay. That's a safe level for them to wear for a couple of hours a day. Okay. And I want to just mention about one more thing. This great question is, you would be surprised the number of teenagers, younger generation that already have tinnitus. Okay. And that's because of their noise exposure. They're living right with those earplugs nowadays. So let's educate them if you can. Okay. Question from David Gauthier. I have Phonak Marvel hearing aids. Am I supposed to turn them off at night when I put them in the charger? I haven't been doing that. No, David, all the rechargeable hearing aids, once you put them in the charging case, it turns it off by itself. Okay, so you put it in the charger, turns it off. When you pick it up, it turns it on by itself. Okay, so you don't need to do that. So even though you're doing the right thing. Pauline McNutt, she's asking, have you heard of arthritis in the bones in the ear causing hearing loss? Yes, we call that as a otosclerosis. It's kind of arthritis. It's just the bone, one of the bones in our middle ear that causes stapes. It stop moving. It's just kind of it gets stiff, and then the vibration of the sound is not going to be the same, so you're not going to be getting the proper sound to your brain. Yeah, so this is a condition, is a genetic condition that happens, it can happen in men and women, one side or both ears. And it's a very gradual change, and it normally you have other family members with that disease as well. Okay, yeah, so that's something that can be diagnosed. Of course, we can do the hearing test, send you to a ear, nose, and throat to confirm if that's what you're suffering. In some cases, surgery can be a solution for those type of hearing losses. And in some cases, hearing aids will be the solution. And if you do hearing aids, those are patients that do very, very well with hearing aids. Okay, I would say they're my easy patients. All right, Beverly, do hearing aids protect hearing loud noise by compressing it? Wonderful question as well, Beverly. So yes and no, I would say. Yes, because the hearing aid has what we call as a maximum output of the hearing aid. So basically, when we do your hearing test, we are going to measure the sound level that is when it start getting uncomfortable for you. Okay, and we set that. So the hearing aid, when there is sound going in your ears, if it gets higher than that level, your hearing aid will compress. So it will protect your hearing. But it depends on the type of hearing aid you have and the hearing loss. So let's say you might have a mild loss and you were wearing those behind ear hearing aids that have a little rubber inside the ears. Then the sounds from outside are still getting into your ears through your natural hearing, right? So in those situations, the hearing aid might help a little bit, but it's not really giving you the best protection in there from those sounds. And if you are exposed, or depends on the environment you are, you might still require to wear perhaps like headphones type of hearing protection that can help. Okay, that is a challenge, I would say, for patients that wear works in maybe in factories and noisy places. There is always a bit of this issue because we want to protect the hearing, but at the same time they need to hear. So it is a little tricky, but yeah, that'll be my answer to that question. All right, so I have a question from Dasha Papat from Halifax. Hey, Halifax. My father is a loyal customer at Connect Hearing, and I have a question. My father can hardly hear in his left ear. Do you suggest just hearing aids for both ears or just one for the right? Wow, guys, you're amazing questions today. So there is two answers for that question, I would say. So sometimes the majority of patients, they have very symmetric hearing loss. We have hearing loss in both ears, but there are cases where one side is deteriorated more. And when we do a hearing test, we can't really understand the speech in that poor ear, okay? There is a technology that can help for that calls cross hearing aid. So basically they still wear hearing aids in both ears, but in the poor ear, you just have a transmitter that will send the sound to the good ear, okay? That's one of solutions. But there are some scenarios, and we can do a test in the office for that we still wear both hearing aids because the combination of the sound coming from both ears will give a better benefit for us to understanding speech, even though that poor ear by itself cannot help much. But when the combination of both are working together, the benefit is much better, is much higher, let's say, than if we are just amplifying the good ear. Okay, so I would say the majority of time, both ears is better, unless when we have both hearing aids, that the poor ear is affecting the good ear. So it can be a little challenging here for me to explain, but I would say, Dasha, probably is better to keep both ears, okay? And also, some patients will be a better candidate to wear cochlear implants, okay, in that side, that is the poor ear, and we needed to keep up with the stimulation with hearing aids to become a good candidate for cochlear implant in the future if they want to, okay, or if they can be one, okay. So hopefully that answered your question. All right, hey, is hearing test free? Yes, we do have a complimentary hearing test for anyone over 55 years old, okay? Kevin Leningan. So I'm having problems with my custom ear molds. Okay, they have been checked, but when I got them back, my voice sounds like my finger is stuck in my ears. My audiologist, Sarah at Clayton Park Connect, said it's some mold only fixed the wire. Why is this happening? So I understand when you talk about custom ear molds for the hearing aids, right, Kevin? So you were feeling pretty much like an echo in your head. There's a lot of things we can talk about this issue, okay? So sometimes, and I'm sure Sarah helped you here, that we can increase the ventilation. So sometimes you need to add more air through your ears in order to not have that feeling of echo or hearing your voice too loud. The other fix sometimes is making the mold a little deeper in the canal. That can also help for that feeling. And there are some scenarios here where if you are not wearing your hearing aid enough, you're going to always feel your voice loud in your head. When you start wearing hearing aids, it's normal for you to hear your voice different. Okay, I don't know if you are a new user or you have been wearing hearing aids a long time, but if you are a new user, that's a common feeling in the beginning that takes a while for your brain to adapt. But there are some modifications we can do for that, okay? Oh, there we go. I think it's a different mold. Vent hole seems smaller than my other custom mold. So Kevin, bring that up to Sarah. If the hole is smaller, that could definitely be affect your own voice. Okay. All right, Denise said, Roger sounds like it's for me with my hearing aids. Yeah, Denise, just talk to the hearing care professional, to one of your audiologists, and I will help you and see if that's a good option for you. All right, so Dasha says here, my father has a severe hearing loss. What kind of hearing aids do you suggest? The majority of time when we have a more severe hearing loss, the behind the ear, and most likely not the very tiny ones. We might need to get a little larger size that has more power. Okay, so that probably, I would say, if I just think about a severe loss, that's usually the best hearing aid. I would say technology has come in a long way. Even the small behind the ear sometimes can help severe losses, but it depends on the size of the ear canal, the type of hearing loss. So we cannot take a look on that. But probably I would say behind the ear, we call it full behind the ear. Okay. Thank you, Beverly, for saying that my presentation was great, good information. Oh, Mike McGee, nice seeing you. It was great to see you in the office last week. My Shay said here, I have a situation. My left ear is not working as my right ear for almost 30 years. Like if I am in a very noisy area, I feel a little bit irritated and make me feel getting a headache. Totally. So that's, I think, is exactly what I mentioned to you. Even we need to understand that we have 2 ears for a reason. Okay. So even if one side is not functioning as well as the right, that's going to already affect your communication skills. So we need both information coming from both ears to localize sounds, to understand the speech in background noise. And if that's not happening, we're adding a lot of cognitive load. Remember, mention about that. So you really needed to focus and strain a lot throughout the day, and that can give you a headache, that can make you irritated. So there's many other, health feelings that you have when you don't treat hearing loss. So me, Shell, have your hearing checked. We need to do something about your left ear. Okay. Okay, I think I already answered. Kevin, when will the aids be upgraded for Bicross? We have a new Bicross, I think, coming up very soon. So I think we do. Okay, but we already have a really good one. I think it's a Paradise. It's already, top-notch cross system there. Pauline, it was a specialist at diagnosis. It's just as a hearing test. Okay. Hey, hi, Roy. How are you from the island, right? I'm pleased you mentioned safety when outside. Yes, definitely. I know the female runners for sure who run alone. We need to always think about safety, everyone. There is a great, for thinking about safety, you can also wear bone conduction headphones. That can be a great option for some people, that they can keep the volume low, their ear canal is not blocked, so they can run and still hear around them. So there's so many options out there nowadays. Yes, cochlear implant. Oh, you have cochlear implant, Bev. Like, I'm passionate about when patients get cochlear implant and they do so well. So great to hear that you're doing well. Let's see. Okay. Rodger Randall, is there any help for tinnitus? Yes, there are ways to manage tinnitus for sure. I can tell you that there is no cure per se, but there's ways we can help you to habituate to tinnitus. I will bring a really good information on tinnitus soon. I think in February is Tinnitus Awareness Week. So stay tuned and bring more information about that. Okay, Kevin, thank you. Okay, I think I got all of them there. I don't know if I have any private chat from my colleague here. Oh, I forgot to mention, everyone, for the prize, you can add the comments, watch it later. So if you have friends within 24 hours, okay, I forgot to mention that. So you have 24 hours to enter, and hopefully you can be one of the winners there. So share the video with friends if they want to, maybe get the prize. And yeah, so I think that's what I have for today. We are about 40 minutes live here. Hopefully I answer all your questions. If not, add some comments there. I'll go back, we'll check it, and get back to you. And I'm always thinking about what are the other topics you want to hear from me. So maybe that's something you could add on the comments, bring it up, different topics that you have in mind or different questions that I can bring it up on the next Facebook Live. Okay, so very nice having you all here. I see some hearts there, some likes. Thank you so much. And yeah, stay safe, stay connected, and hopefully to see you again soon. Okay, and have a wonderful holidays. Okay, bye bye, bye bye, everyone. Take care.